Welcome back to Smitty's Learning Room. Now that we've finished having a look at measuring health status, we're now going to have a look at how we identify priority health issues in Australia. In order for Australians to improve their health, governments and health authorities must have a look at the nation's health status and some of the epidemiological data to prioritise health issues. And generally they're based on how much they contribute to the burden of illness in a community and their potential for reducing this burden. These priority issues, which we're going to have a little look at later on, are the health inequities experienced by certain groups within our societies, our growing and ageing population, and the high levels of chronic disease and other health problems that are evident in our society. So when we try to determine the things that are going to be the greatest burden on our community and obviously has potential to be reduced, health authorities need to consider several factors. And these factors are the social justice principles, priority population groups, prevalence of the condition, potential for prevention and early intervention, and costs to the individual and the community. Let's start by having a look at social justice principles. Now we know from Year 11 that social justice is basically the concept of trying to eliminate inequity and promotes diversity and inclusiveness and establishes environments that are supportive of all people. Any priority issue for Australia's health obviously must reflect the principles of social justice, and we need to recognise and address inequities that exist in health. These inequities look at both differences in the incidence and prevalence of sickness and death, and inequities in the social, economic, political and cultural factors that influence health. So it's not just having a look at the statistics, but also having a look at the factors that influence our health. When we look at the concept of diversity, we look at the idea that as a nation, for us to be able to improve our health, we have to understand the diverse nature of the people living in our country. And diversity comprises of the differences among different people and individuals. And it's really important to understand the different needs of our diverse communities in order to improve health. The final part of social justice principles are supportive environments. Now obviously we can't have this decrease in inequities, or we can't have an example or an understanding of diversity if we don't have supportive environments to actually promote good health amongst these the diverse environments that Australia has. So it's really important that as a government and health priorities are targeted towards supporting environments so that we can actually help break down barriers and promote diversity within communities. When we have a look at priority population groups, it's really important to understand that Australia is known and identified by its diversity and multiculturalism. So when we talk about the concept of multiculturalism, we looked at the fact that we've got a coexistence of groups living in one society, representing different cultural and linguistic backgrounds. So having a look at Sydney, we've got lots of different people living in our city from lots of different countries, whether they were born overseas or born here in Australia with foreign heritages. Just shows the level of multiculturalism that we have in our city. As a nation, we have quite a few subgroups within our country that have significantly different health statuses. And obviously these different statuses reflect on our health as a whole nation. So it's really important to identify the priority population subgroups to enable to determine health priority issues. And once these subgroups have been identified, it allows health authorities to determine the health disadvantages of groups within the population, helps them to better understand the social determinants of health, identify the prevalence of disease and injury in specific population groups, and determine the needs of groups in relation to the principles of social justice. Now when we have a look at the epidemiological data, it shows us that Indigenous populations have much higher death rates from heart disease, injury, respiratory diseases and diabetes. So this is obviously a priority population group within Australia. People from low socioeconomic background have a higher incidence of disease risk factors such as high blood pressure, high cholesterol levels, smoking and lower use of preventative health services. This is also another priority population group in Australia. Another priority population group in Australia are those people living in rural or remote areas, and they have higher death rates and a higher incidence of heart disease and injury compared to those who live in metropolitan or city areas. And finally, interestingly, men are at much greater risk of women than developing a number of diseases, including heart disease and lung cancer. These are only a few examples of some of the subgroups in Australia that have specific health issues, but these are the main ones that are identifiable. Another factor which helps us determine health priority issues is the prevalence of the condition. This is where epidemiological data is really handy and helps us to identify these issues through the prevalence. So obviously high prevalence rates of a disease can indicate the health and economic burden that the disease or condition places on a community. And so, for example, cardiovascular disease is a leading cause of preventable death in Australia. So by having a look at the prevalence of disease, we're able to have a look at which diseases can be controlled and which ones can become a priority for us to deal with as a nation. The next concept we have a look at is the potential for prevention and early intervention. Now, the majority of diseases and illnesses that are suffered by Australians are generally as a result from poor lifestyle behaviours. So these are things that we can change ourselves, like poor diet, our exposure to the sun, our exercise levels. So the potential for prevention and early intervention obviously identifies that for change to occur, that is for the burden of diseases to be reduced, we must be able to address both individual behaviours and environmental determinants such as the infrastructure around us, the amount of hospitals available to us, the amount of sporting fields available to us, the education that we have access to. And these two combined, the individual and the environmental factors, can obviously lead to improved health status. So the final aspect of what we need to look at when we identify health priority issues is the cost of the individual and the community. And we know that illnesses and disease can actually place quite an economic burden on the health infrastructure, but also on the individual. And this can be determined by financial or mental health burden or physical health burdens. And it's really important to identify that the cost of treatment for the individual and for the health infrastructure is quite high. So this is the sort of concept where we look at how can we decrease the cost to the individual and the community by identifying a priority health area. When looking at economic or financial terms, we look at the impact of the disease and how much does that actually cost health authorities, and we can actually have a look at that by looking at the direct cost. So that's how much money has been spent on diagnosing, treating, caring for sick people, and also the money that's spent on prevention. We then have a look at the concept of indirect costs. So, what has been lost or what has cost the family or in relation to that person becoming sick or having to die prematurely or finish work earlier than they would have. So what are these impacts on the family? They may not necessarily be financial, but they might be an indirect cost to the family or the community or the individual. So in summing up this concepts here today, we look at that in identifying health priority issues, it's really important for health authorities to apply the principles of social justice, which are equity, diversity, and supportive environments. And in identifying health priority issues, health authorities also need to consider groups that experience inequities in health, the prevalence of different diseases, the cost of disease to the individual and community, and the potential for early intervention and prevention in health areas.